Today, we're going to talk about sciatica, how to fix sciatica in the fastest time possible. Sciatica goes by several names like sciatic nerve dysfunction, low back pain, or lumbar radiculopathy. As sciatica is a symptom of a more specific medical condition, the underlying cause should be identified and treated. So in this video, we will look at two key components in tackling sciatica. That is one important vitamin you need to fix sciatica and another important mineral you need to fix sciatica. Hi, I'm Dr. Raylee. Welcome to my channel. If you're new, make sure you subscribe and hit that bell and give us a thumbs up by tapping that like icon because you will definitely get value out of this video. Thanks a lot. Sciatica is that pain, weakness, numbness, or tingling sensation along the sciatic nerve, running from the waist region down to the buttocks to the legs. And sciatica occurs when there is compression or pressure on or damage to the sciatic nerve. The sciatic nerve comes all the way from the lumbar region or the lumbar spine to the sacral region down to the feet, and it is the longest and largest nerve in the body. This nerve controls the muscles of the back of the knee and lower leg. And there are many causes of sciatica ranging from slipped or herniated discs, spinal stenosis, or what we call piriformis syndrome. That is a pain disorder involving the narrow muscle in the buttocks. We have pelvic injury or fracture, some tumors, or what we call spondylolisthesis, myeloneuropathy, vitamin and mineral deficiency, and even folate deficiency. And about 90% of the time, it involves the first cause, that is the disc, the connective tissue, where you get what we call degeneration of this cushion-like disc. And once there's degeneration, it wears out, and that can put pressure on some of the nerves that make up the sciatic nerve. And then you experience excruciating pain at the back, down to the buttocks, all the way down to the lower part of the legs and even to the foot. So in this video, I will be talking to you about the vitamin and mineral aspect of sciatica treatment and management to alleviate the discomfort. It shows that these vertebral discs along the spine depend on this cofactor mineral called copper, because the coenzyme needed to build collagen in the connective tissue needs copper. And guess what? Your vertebral disc is made up of about 70% collagen. So copper is the number one mineral you need when someone suffers from sciatica. And copper is also used by enzymes involved in neurons, nerve transmission, and the myelin sheath. And so it is not surprising that copper is the number one choice when sciatica resulting from a displaced disc or what we call herniated disc is recommended. Now you may ask, what foods can we eat to increase our copper levels in our body? Foods rich in copper include the organic meat liver, oysters, shellfish, dark sugar-free chocolates, grass-fed meat, and even cashews. And if you want to go for the supplementation, which I do recommend for you, go for 2 milligrams of copper per day for starts. That will be the ideal, and slowly increase that over a period of 1 month to heal the disc and the nerve. And after a month, you can reduce or adjust the dose to see what dose works best for you. Now, I'll come back to this copper issue again after I tell you of this vitamin you need in addition to copper. So the vitamin you need will be vitamin B2, that is riboflavin. The sciatic nerves needs nutrients to function effectively, but a deficiency in this particular vitamin, that is vitamin B2, creates the most damages in that nerve. And a vitamin B2 deficiency could be created because you are not consuming enough foods rich in this particular vitamin, or commonly a problem with your gut or some type of malabsorption. Again, some foods rich in vitamin B2 include the liver, beef, shellfishes, mushrooms, olive fish, the nuts, the cheese, eggs, and the leafy green vegetables. And I will also recommend, in addition to eating these foods, go for a vitamin B2 supplement of the whole B complex to make sure you supply all the vitamins it needs, because you could also damage your sciatic nerve from a deficiency in B12 and B1, which are very helpful in managing what we call peripheral neuropathy. All right, back to the copper issue. I want us to look at those who are likely to be deficient in copper so that we can help ourselves. And that will be those who eat low copper diet. So if you're not eating food rich in copper, you could end up with a damage in the sciatic nerve. And then number two will be athletes. And that is because they use up a lot of energy that requires high demand of copper. So the more you exercise, the higher the demand. And if the athlete is not eating right, they could end up with a deficiency in copper. Also, if you take a lot of zinc without complementing with copper, you could end up with a copper deficiency. Then too much of iron, stress, or too much cortisol, high potassium diet, high levels of niacin, that is vitamin B3, gastric bypass, too much sugar, alcohol, and regular consumption of aspartame containing foods, and so forth. And in addition to taking your copper supplement and eating the food rich in copper, there are other copper therapies for sciatica. We have what we call copper bracelets, the patches. And there are pretty amazing testimonies with this copper therapy. So you can go to Amazon.com and get a copper bracelet, a copper patches, or even a copper cream or ointment for temporary relief of the discomfort of the pain you feel when you have the sciatic nerve issue. So this is one of the ways to fix your sciatica in the fastest time possible. If you know anyone who suffers from sciatica, low back pain, or what we call the vertebral radiculopathy, please consider sharing this video with them. It is super important, and that will help them fix their sciatic nerve issue. Thanks for watching Your Health, Your Life. I'll see you in the next video.